Hi guys, this is Dr. I, and welcome to my channel. In this week's episode, we are going to be discussing about one of the most common clinical scenarios that every medical student, doctor, or any other healthcare professional may face in their day-to-day practice. We are going to talk about what is syncope, what are the different types of syncope, what are the causes of syncope, and how to approach a patient who presents with syncope in the emergency department. If you're new here, don't forget to subscribe and hit the bell icon for getting notified whenever I upload a new video. And if you have already subscribed, thank you so much. And also let me know in the comments section below what you feel about today's topic and what else you would like to learn from my upcoming videos. Without any further delay, let us get started. Syncope is defined as a transient, usually benign, loss of consciousness, which is not due to any psychiatric condition, and lasts for a few seconds to a few minutes, and then the person regains the consciousness. It is commonly known as fainting. Syncope happens when there is inadequate perfusion to the brain for a brief period of time. When it occurs, it is often due to an underlying pathophysiologic process rather than being an isolated incident. So basically, you can say that syncope is a symptom rather than a disease itself. Based on the duration of symptoms, we can divide syncope into two types: acute and chronic. Acute syncope refers to events lasting seconds to minutes and resolves spontaneously within that time frame. Chronic syncope refers to events lasting longer than 24 hours. The most common cause of acute syncope is vasovagal syncope, whereas the most common cause of chronic syncope is orthostatic hypotension. But remember, these are not absolute, and there could be exceptions. The causes of syncope can be broadly divided into three categories: cardiac, neurological, and metabolic causes. In this episode, we will discuss only the cardiac causes of syncope. Cardiac causes of syncope include arrhythmias, valvular heart diseases, coronary artery disease, and cardiomyopathies. Arrhythmias such as bradycardia, tachycardia, and various types of blocks can lead to syncope by causing either reduced cardiac output or inadequate tissue perfusion to the vital organs, including the brain. Valvular heart diseases like aortic stenosis can result in insufficient blood flow to the brain, leading to syncope, especially during periods of increased demand like exercise. Similarly, coronary artery disease can cause myocardial infarction, which if severe enough can lead to cardiac arrest and eventually death. Various types of cardiomyopathies, such as dilated, hypertrophic, and restrictive cardiomyopathies, can impair the heart's pumping ability, resulting in poor blood circulation and ultimately leading to syncope. So now let's see a typical scenario in the emergency department. A 62-year-old man presents to the emergency department with a chief complaint of feeling faint. He was exercising on the treadmill at his usual level of intensity when he suddenly felt lightheaded, sweaty, and weak, and then he noticed that he lost his balance and fell to the floor. He regained his consciousness after a few minutes and called 911 for help. His wife reports that he has had similar episodes in the past and recovers fully after each episode. He does have a history of hypertension and type 2 diabetes mellitus, for which he is currently taking medications. On examination, his vitals are stable. His heart rate is around 75 beats per minute. Blood pressure is around 120 by 80 mmHg, and respiratory rate is 16 cycles per minute. Examination of the cardiovascular system reveals no abnormalities in heart sounds. There are no peripheral pulses, and capillary refill is less than 2 seconds. Examination of the respiratory system is also within normal limits. Initially, the patient was conscious and was able to answer questions appropriately. However, after 30 minutes he became drowsy and stopped responding to commands. So, what is your working diagnosis and what investigations would you order for him? If you've made it this far, thank you so much and I really appreciate it. Please don't forget to show your support. If you find my videos helpful, please subscribe and hit the bell icon for getting notified whenever I upload a new video. You can also check out my social media accounts where I share additional learning resources as well as my personal experiences as a doctor. I would love to connect with you there. Now let's discuss the investigations and management of this patient. This is a classic case of cardiac syncope, and the most likely diagnosis is vasovagal syncope. Vasovagal syncope is a form of neurocardiogenic syncope triggered by a specific stimulus like pain, stress, or dehydration. These stimuli cause an excessive and sudden sympathetic response followed by a pronounced parasympathetic overactivity. This leads to profound bradycardia, which causes cerebral ischemia and results in syncope. Electrocardiogram should be performed to rule out any underlying cardiac arrhythmias, which could be contributing to this patient's symptoms. Holter monitoring may be considered if initial ECG findings are non-contributory. In this case, the ECG should be interpreted in the context of this patient's symptoms and medical history. For example, a first-degree heart block may be more concerning in a patient who has a history of Wolff-Parkinson-White syndrome compared to a patient without a history of WPW. Remember that the presence of an arrhythmia on an ECG does not always indicate that it is the cause of the patient's symptoms. This is important because some arrhythmias may be innocent and not cause any symptoms. Therefore, a thorough history, physical examination, and other investigations are crucial to determine the underlying cause of syncope. We should also perform blood tests to assess for other possible causes of syncope, such as anemia, hypothyroidism, electrolyte imbalances, and other metabolic abnormalities. In this patient, we must check for blood sugar levels since he has a history of diabetes mellitus, and hypoglycemia can cause symptoms similar to vasovagal syncope. In addition to these investigations, we should also consider performing a tilt table test. This test helps to identify patients with neurocardiogenic syncope who might not respond to standard treatment strategies. The test involves tilting a table on which the patient is lying down at a 60 to 70 degree angle. The patient is monitored for any changes in heart rate, blood pressure, and other vital signs. A positive test shows a drop in blood pressure and a rise in heart rate, indicating a high likelihood of vasovagal syncope. While awaiting the results of these investigations, we should manage this patient based on our initial assessment. Our primary goals should be ensuring adequate oxygenation and circulation to the brain, preventing injury, and providing emotional support. Since this patient regained consciousness, we can discharge him home with appropriate follow-up. However, if he remains unconscious, we should transfer him to the intensive care unit for close monitoring and further management. It is important to emphasize that syncope can be a complex and challenging symptom to investigate and treat. A multidisciplinary approach involving cardiologists, neurologists, internists, and other healthcare professionals is essential to ensure comprehensive evaluation and management of patients presenting with syncope. I hope you enjoyed this episode and found it useful. Let me know in the comments section below what you think. Don't forget to like this video, share it with your friends and colleagues, and hit the subscribe button for getting notified whenever I upload a new video. Thank you so much for watching and supporting my channel. Stay healthy and take care. God bless you.